Welcome to Pagets Awareness Day 2022. I'm Dr Tori Herridge, an evolutionary biologist at the Natural History Museum in London and a friend and supporter of the Pagets Association. Paget's disease of bone is the second most common bone disease after osteoporosis, but many people have never even heard of it. And there is still so much about Paget's that we don't know. But thanks to the work of the Pagets Association, this is changing. And this year, the association is bringing a global perspective to bear on Paget's disease, to challenge the idea that Paget's is solely a British disease, and to explore what we can learn about the causes, history, and treatment of Paget's disease by looking beyond the confines of a single country. It's my great pleasure to welcome you all to this year's series of video interviews, where I'll be interviewing experts from across the globe to hear their unique perspectives on Paget's disease of bone. For this episode, I'm talking with Dr. Daniela Merlotti, who is a clinician based at the University of Siena in Italy. Welcome, Dr. Merlotti.
Hi Victoria.
Hi, it's nice to meet you. Piacere.
Nice to meet you too. Piacere.
Can you tell us a little bit, Dr. Merlotti, about yourself and how you became involved in Paget's disease?
Yes, of course. Thank you very much for your kind presentation and for giving me the opportunity to speak about Paget disease in my country, Italy. First of all, I am an internist. I'm working in Siena at the University Hospital. And my first involvement in Paget disease of bone was in 2003, during my studies at the post-graduation school in internal medicine, after my medical degrees. And I had to collect data from our patients in an outpatient service at the hospital, and I started to take care of this patient. Subsequently, I started my research activity in this field, also participating in many international meetings in Paget disease of bone. And I remember, like it was yesterday, my first meeting in Oxford in 2005, because I was so excited to meet all the top international expert clinicians in this field.
I mean, how common is Paget's disease in Italy?
Yes, Paget disease is present also in Italy, but since Roman times and also in the Middle Age. The prevalence in our country is about 1.5%, so it is reduced with respect to what we observe in UK. And the pathogenesis is quite similar. We have both genetic and environmental factors, but the prevalence is different from your...
Yes, and you've just hinted that there's been migration between these areas, which makes me think you're suggesting genetics.
Yes, of course. Campania in the past had different colonization, so a mixture of different population also from the north of Europe that came from the north to the south for dominations. I remember in the 12th century with the domination of the Normans, just for an example. So the Campania was very active to the interchange between people, and also the attitude to the consanguinity marriages between the people from Campania, I think could be an important point for this hotspot generation in this area.
Yes, I mean, and is that the case? Is there not only a high prevalence of Paget's disease of bone in Campania, but also a high prevalence of familial Paget's disease of bone?
Yes.
Yeah. Okay, interesting. And so the consanguinity is there's sort of a lot of kind of closely related marriages.
Especially in the past, not now, but in the past, big families and a lot of consanguineous marriages between people in the same family. So it is a point very important to understand this particular prevalence in this region of the Italy.
And is there anything, can you see that in the genetics? Are the genes associated with Paget's disease of bone in Campania unusual?
We found a particular gene in Campania regarding the ZNF687 gene. This is a special gene associated with Paget disease and giant cell tumor. That is a neoplastic degeneration that rarely occurs in this patient. And this mutation is only in Paget patient from Campania, so it's unique.
Wow.
It's very important also from a epidemiological point of view and also for a genetical point of view, because these people with this mutation in particular have a disease more aggressive. The age of onset is earlier and they need more and more treatment to control the disease. So it's very important. And this is typical all for the Campania region and patient originally from this part of Italy.
It's really interesting because I had a really fascinating conversation with Dr. Letitia Michoud, who is based in Quebec, and her research on the Quebecois showed that animals, like, association with animals did not come out as a factor, a risk factor. But what she pinpointed was this association with wood fires heating. And she also found an interesting association with French data with tobacco smoke. And she has this idea that maybe smoke, or at least the compounds you find in smoke, is an important factor. But yet you haven't seen that. I mean, is there any way that you might have seen something similar in the Campania region, that we can draw a connection between this research?
We don't have any data about this point. I know the data from Letitia, and there is the possibility that also in that part of Italy, some lifestyle factors like food fire could be also important for the development of the disease. I mean, just the story about the volcano eruptions that are very famous in this campaign, Montus Vesuvium. And
Mount Vesuvius. I mean, that's a very famous volcano.
And it's very interesting because the eruptions of this volcano tends not to spread not only towards the seaside, but also in the internal region of the Campania, in which Avellino is set, one of the town with an increased prevalence. So it could be possible that all the gas from the eruptions, also the high temperatures with the increased burning materials and components that could produce, could also have a role in the high predisposition of people living in this part of Italy to develop the disease. But we have not any data about that, but it could be interesting.
But are there other important or interesting differences you've noticed with Paget disease in Italy more broadly when compared with other countries?
From a genetic point of view, we found that in Italy we have a very high number of mutations, also in the other gene that is involved in Paget disease of bone, the sequences of gene. We have the number, I think, the most higher number with respect to other countries, higher variability of sequences of one gene mutation and variation. And also in these patients, so the patient with this type of mutation, we need to use aminobisphosphonate, intravenous aminobisphosphonate to have a good disease remission. So also this point is very important because it's important to treat patient with the right drug at the right time.
I mean, you have done some quite interesting stuff with approaches to treating various aspects of Paget's disease. I noticed that you've worked a little bit on the effect of vitamin D. I mean, I don't know if you want to elaborate on that, because is that something that might change things?
Yes, it's a very important point. I thank you for giving me the opportunity to speak about. Hypervitaminosis is a very important point also in a Pagetic patient. It's quite common. And we saw that in patients that received aminobisphosphonate, especially in the intravenous aminobisphosphonate, the administration of vitamin D supplements could be very useful to reduce the adverse events that usually occurs after this type of treatment, that are hypocalcemia or acute phase reaction, that is a flu-like illness. And so it is very important to normalize the vitamin D levels of Pagetic patient before the treatment, because in the main part of patients have reduced levels of vitamin D, and usually below 20 nanograms per milliliter. So it is very important to correct this deficit before the administration of this type of drug.
And that is something that would you recommend that more broadly, or do you think it is more of a problem for Italian patients?
No, I think this problem is very common worldwide, not only in Italy. But we have the possibility to have a look, an inside look in this point, because we performed 2 different studies, and in a retrospective study, an interventional study, and we confirmed this hypothesis.
Yeah, and that's just it, isn't it? I mean, you have this really interesting comparison between the hyper regionalized approach where you need to understand your local area, it's minute detail to understand what's going on regionally, and yet the things you find out have massive implications globally for sufferers of Paget's disease of bone. And I think that international perspective I find really, really fascinating. Thank you for joining us for Paget's Awareness Day 2022, Dr. Merlotti, and thank you all for listening.